Hi and welcome back to another video of Medic Notes. This video will be on carpal tunnel syndrome. Carpal tunnel syndrome is caused by pressure on the median nerve. And this is a picture showing the carpal tunnel. So it is a narrow passageway surrounded by the bones at the wrist and also surrounded by ligaments on the palm side of the hand. So the median nerve is one of the components in the carpal tunnel. And this median nerve will compete with other tendons and other structures for space within the wrist. So compression is common, especially in women who have wrists, but similar sized tendons if compared to men. So women is more common to have carpal tunnel syndrome. The causes can be due to anything causing swelling or compression of the carpal tunnel, such as myxedema, prolonged flexion, for example in someone who has Colles splint, acromegaly, myeloma, local tumors such as lipomas or ganglion, rheumatoid arthritis, amyloidosis, pregnancy, and also sarcoidosis are some of the causes. For clinical features, the patient will complain of an aching pain in the hand, especially at night. Paresthesia, where there is numbness in the thumb, the index and middle fingers. These are the areas supplied by the median nerve. And this numbness is often relieved by dangling the hand over the edge of the bed or shaking it. There may be sensory loss and weakness of the abductor pollicis brevis, plus minus wasting of the thenar eminence. Light touch, 2-point discrimination, and sweating may be impaired. There are some physical examination tests that we can do to help suggesting for the diagnosis of carpal tunnel syndrome, such as Phalen's test, where you see in the upper picture, ask the patient to do a maximum wrist flexion for 1 minute, and this will be able to elicit symptoms. Another test is Tinel's test, where the examiner will tap over the median nerve at the wrist, and it can cause tingling. And the symptoms that we should look out for when doing both these tests are any pain or paresthesia, where there is numbness over the wrist. But both these tests are non-specific. So there are other investigations to help confirm the diagnosis. So we can recommend doing an X-ray of the affected wrist to exclude other causes of the wrist pain, such as arthritis or even a fracture. However, X-rays are not helpful in making a diagnosis of carpal tunnel syndrome. It only helps to rule out other differential diagnoses. Ultrasound of the wrist can get a good picture of the bones and nerve and determine whether the median nerve is being compressed, which increases the risk of carpal tunnel syndrome. Electromyography is a test that measures the tiny electrical charges produced in the muscles. So this test can help to identify any damage to the muscles which are controlled by the median nerve, and also can help to rule out other conditions. Nerve conduction study can also be used to diagnose the condition. For treatment of carpal tunnel syndrome, it includes the splinting of the wrist, where the doctor will place a splint that holds the wrist while you sleep. So it can help to relieve the nighttime symptoms such as tingling and numbness. And even though the patient only wears the splint at night, it can also help to prevent daytime symptoms. Corticosteroids, where the doctor may inject the carpal tunnel with a corticosteroid such as cortisone to relieve the pain. And it can also help to reduce the inflammation and swelling. Thereafter, relieve the pressure on the median nerve. Decompression surgery can also be done in some cases where the surgeon will make an incision in the palm of the hand over the carpal tunnel and cut through the ligament to free the median nerve. That is all for this video. Thank you.